My name is Dr. Weatherhead and I'm a consultant dermatologist in Newcastle. In this video, I'm going to talk to you about biologic treatment for inflammatory skin disease, including psoriasis, hidradenitis suppurativa and eczema. If you're being started on either adalimumab or dupilumab, there's a further specialist video for you to watch, and that gives you more information on these medications specifically, and we will include a link to this at the end of the video. There's also written information for every single biologic, so whichever one you've been offered, please make sure that you take the time to read the written information about this, and again we'll provide a link to that if you haven't been given it by your team already. Please make sure that you take the time to speak to your specialist nurse or to your doctor about your treatment and have the opportunity to ask any questions before you start. In this video, we're going to discuss practicalities of how to start treatments, how they'll be delivered, storage and travel, and some information about safety. Biologics are the most effective treatment options that we have available for inflammatory skin disease, and it's likely that you'll have been offered other treatments before starting this. Biologics are suitable for most people, but it's important that you let your dermatologist know if you have any other medical problems or illnesses, and that includes allergies, before you start your treatment. In particular, we want to know if you've had exposure to tuberculosis in the past, if you've been diagnosed with cancer, particularly in the last 5 years, and if you have inflammatory bowel disease or ischemic heart disease, as this can affect the choice of biologic treatment for you. Biologics work by targeting very specific bits of your immune system, and you may have previously been given other immunosuppressant medications such as methotrexate, which tend to lower your immune system more generally. Biologics are quite a lot more targeted, so depending on the medication you've been given, it may not cause so much problem with infection. Biologics given in particular for psoriasis and hidradenitis need to be paused if you become ill or if you think you have an infection that requires treatment, such as antibiotics, but do please ask your medical team if you have any questions. Most biologics are given by injection into the skin, and you'll be supplied with a sharps box and also your injection devices, so you put these into your sharps box after using it. Most people manage very well and have very few side effects with biologics, but injection site problems can occur, and this includes bruising, swelling and discomfort around the site you've injected. You can reduce the chance of this happening by rotating where you inject yourself. So for example, you might use your stomach, your thighs or your upper outer arms. The injection is easy to give even if you're squeamish, and we will make sure that you know exactly what you're doing before you start. Side effects of specific biologics are discussed further in other patient information leaflets and in the videos that you should have access to. It's recommended that you carry an alert card with you, and that will be given to you by the specialist nurse before you start treatment. Please make sure that you show it to any healthcare professional before you have a procedure done, and you may want to also show it to anyone if they're going to issue you with any new medication. After your doctor has made the decision for you to start treatment, it will normally take about 4 to 6 weeks to actually get the medication. And this is because there's quite a few steps involved before starting your treatment. And that includes checking your blood tests, ensuring that you are eligible because the treatment requires specialist funding. We need to register you with home care, which is the delivery service, organise how that delivery and when that delivery is going to be made, and arrange for you to have training so you know how to inject the medication. So I mentioned home care. This is a service that will deliver your medication. It's a private company that's contracted by the NHS, and it's responsible for delivering your medication to you. Medicine will be delivered to a designated place that's convenient for you. That might include your home or your workplace, but it's really important that there's somebody there when the medication is delivered. So it could be you, a friend or a relative, but somebody needs to personally accept that delivery, and it's not possible to leave it there if there's nobody there to accept it. The first time you have a home delivery, the home care nurse will show you how to inject the medicine, so you do need to be personally available for this. After that, the medication can be given either by yourself, a friend or a relative, but if it's somebody else, they also need to be there in attendance for the training. If you do have any concerns or you need to make changes to your home care delivery, please contact this service directly. Unfortunately, you're not able to collect your biologic from the hospital, and home care is the only method that we can get this to you. So by agreeing to start the biologic, you're actually giving your consent to home care to have your details, which would include your name, phone number and address, so that they can deliver the medication to you. Please make sure the address we have for you is correct, and you can do this by checking on your most recent letter. So you will have a letter sent out to you at your appointment to say that you're going to start a biologic. And if you haven't received this letter, or if the address is no longer correct, please make sure you discuss this with your consultant secretary and get them to change it as soon as possible. Once your biologic has been delivered to you, it needs to be stored in your fridge. So fridge temperatures between 2 and 8 degrees centigrade. We would recommend storing it in the centre or the bottom of the fridge, not near the back panels, because back panels can freeze and that can affect how viable your drug is. If you're planning on travelling or when you're away, you may need to take your biologic in a cool box, and then as soon as you get to where you're going, store it in the fridge. If you're travelling by plane, it might be required that you have a letter from your dermatologist to allow you to take this in your hand luggage. Please don't put it in your main luggage, as the hold of the plane gets too cold, and this can result in your medication not being as effective. Alternatively, you could just delay when you take your injection, so you may have it just before you go and then have it a few days late when you get back from your holiday. I would recommend that you discuss this with your dermatology team if you've got any questions or you're not sure about how this may work for you, and they will be able to give you very specific advice. Biologics have been available for over 20 years, and they do have a very good safety profile, but we continue to collect information on side effects, and if you have any unusual or unexpected side effects, please do get in touch with us. And we should have given you a number, or you have it on your card. Failing that, it should be on the letter, and again, that'll get you through to your consultant secretary. We do want to know if you've been diagnosed with any new or unusual illnesses whilst you're on your treatment too, or if you have any serious infections. Certain vaccinations are recommended whilst you're on biologics, and that would include your annual flu vaccine, any COVID vaccines that you may be offered, or any other routine vaccinations you're offered by your GP. Live vaccines such as yellow fever should be avoided whilst you're on a biologic. So if you're travelling to an area where you need live vaccines, please contact us to discuss this further. Please don't ignore any routine cancer surveillance invitations that you may have, such as cervical smears or breast screening, or if you notice any lumps or bumps or you're concerned about these, do check them out with your GP or any other healthcare provider. Finally, biologics are thought to be safe in the first and second trimester of pregnancy, although most of them are not licensed for use in pregnancy. Women who are actively trying to get pregnant should let us know as soon as possible, preferably before they conceive, but where possible, we may want to switch you to a different type of biologic with known safety data in pregnancy, but depending on which type of disease you have, this may not always be possible. Sometimes there aren't any licensed medications for pregnancy available to you. If you have any further general questions about biologics, please contact your medical team directly using the telephone number provided at the top of your most recent letter or on the card that you've been issued.